Good morning. I am Dr Chirag Chamria and I am an oral maxillofacial surgeon practicing in Mumbai. So friends, we see a lot of cases of oral cancers, of oral malignancies, of tumors, of cysts, of infections in the jaw. We also come across cases where there is swelling in the neck. The neck swelling can be in the center or at the sides. It is very important as a professional, but even as a patient, to understand what swelling means, which kind of swelling means what. Most common swelling in times of rains is the tonsils. The tonsillar lymph nodes, they swell up, and that causes difficulty in eating, difficulty in speech. But there are other more sinister kind of swellings if we neck. Usually a swelling of the neck on the lateral side or not in the midline corresponds to most commonly a lymph node swelling. A lymph node swelling, it can just be a atypical swelling. It could mean malignancies, it could mean cysts, it could just be an inflammatory reaction. But a neck swelling should always be investigated further. A midline neck swelling usually corresponds to one or the other glands which are present and an abnormality. So the first step for any neck swelling would be an ultrasonography or a CT scan for the neck. With the ultrasonography, we come to know about more details as to which layer of the neck is swollen. Is it the lymph node? Is it the glands? Is it the blood vessels? Based on this finding, we can then further develop the diagnosis by taking a fine needle aspiration cytology, FNAC, or a small biopsy of that region. Usually, patients who come to us with a neck swelling have one of these two things. They either have a lesion in the oral cavity, which is sinister or malignant, spreading downwards towards the neck, or they have an infection in the oral cavity. This infection has grown from a small, minuscule size to a big infection now, and it is creating a reaction in the neck and creating swelling of the lymph nodes. So a neck swelling with USG or CT scan, after which a biopsy of the region would give us more or less a very good clinical picture as to how we need to go forward. A neck swelling can mean a simple inflammatory reaction which will heal itself to a TB lymph node, which means a tuberculosis induced lymphadenopathy, or it could be Hodgkin's or non-Hodgkin's lymphoma, or it could even be a malignancy. Hence, due to this vast array of diagnosis which can just happen from a neck swelling, it is important that you see your specialist today for a neck swelling. Thank you.